Hari Om. Welcome to Yoga Vidya Gurukul, YogaPoint, Yoga Therapy Training Program. We will be talking about thyroid disorders. Now, the thyroid gland is one of the endocrine glands, which develops very early in life. The development of the thyroid gland is almost complete by the ninth week of pregnancy. So, when the baby is in the mother's womb, by the ninth week, the thyroid gland of the baby is already developed. Now, when fully developed, the total weight of the thyroid gland is around 15 to 20 grams, and it is comparable to the distal phalanx of our thumb. It has a very rich blood supply of around 0.5 milliliters per gram per minute. Now, this amount of blood supply is considered to be really more to any given organ in our body. And this endocrine gland, it secretes two hormones, T3 and T4. Functionally, more or less, these two hormones, they are the same, except for the structure of these two hormones. T3 has 3 molecules of iodine and T4 has 4 molecules of iodine. So basically, this thyroid gland, this endocrine gland, it takes the iodine from the blood and synthesizes the thyroid hormones T3 and T4. This endocrine gland is situated in the neck, so just below the larynx or the voice box on the both sides of the trachea, the windpipe, the thyroid gland is situated. So it's just in the neck below the voice box. A closer look, you can see that this gland has two parts, the right side and the left side, and these two, they are connected with each other. So actually they lie on the side of the trachea, and in front of the trachea there is just a connection between the right side gland and the left side gland. It's interesting to understand the secretion of thyroid hormones. As mentioned earlier, there are two hormones which are secreted by the thyroid gland, T3 and T4. But then this secretion, it is actually controlled by the hypothalamic anterior pituitary thyroid axis. The hypothalamus secretes a hormone, TRH. Now this hormone, it goes and influences the anterior pituitary gland. Now when this anterior pituitary gland is stimulated, it secretes a hormone which is called as TSH. Now this TSH has an effect on the thyroid gland. It stimulates the thyroid gland, and then the thyroid gland secretes enough quantity of T3 and T4 which act on our body, which work on the peripheral tissues. Now, interestingly, when the levels of T3 and T4 they are enough, They are within the normal range. It sends a negative signal, a negative feedback mechanism to the hypothalamus and the pituitary gland. With this negative feedback, the hypothalamus and the pituitary gland reduces the secretion of TRH and TSH. Now, when the secretion of TRH and TSH is reduced, the thyroid gland receives less signals, less stimulation, and the levels of T3 and T4 they start reducing. The moment T3 and T4 starts reducing, the negative feedback signal which is sent to hypothalamus and pituitary is stopped. So again, the hypothalamus and pituitary they start signaling the thyroid gland for secreting more amount of hormone. So based on this negative feedback mechanism, T3 and T4 levels in our body they are maintained within normal limits. So actually a healthy functioning of the hypothalamus, the anterior pituitary and the thyroid glands is essential to maintain the normal levels of T3 and T4 in our body. What are the functions of this T3 and T4 or thyroid hormones? The most important function is to accelerate, to enhance the energy production in our body. So it stimulates the tissues, it stimulates the cells to produce energy to accelerate the production of energy. So it also increases the oxygen utilization and it stimulates the basal metabolic rate of the tissue. It helps in increasing the glucose absorption from the digestive system. It helps to mobilize the glycogen, the stored form of glucose from the liver into the blood. So it can actually increase the glucose levels in our blood. Similarly, it increases the protein synthesis, production of proteins, and at the same time, it increases the synthesis of lipids, of fats, and at the same time, it also helps in more utilization of fats. So overall, we can say that it increases the basal metabolic rate, it increases the energy production and the synthesis of proteins and fats, along with more absorption of glucose in our body. On the other organs, it increases to improve the kidney function. It's also essential for the normal activity of the heart, the nerves, and the muscles. So actually, it stimulates, it increases the thyroid hormones. They would increase the heart rate. They can increase the nerve activity and the muscle activity. And overall, we can say that it is essential for the normal development, normal growth of the human body. Now, we will talk about iodine deficiency disorders, or in short, IDD. Now, basically, as mentioned earlier, the thyroid hormones, they are secreted by utilizing iodine from the blood. So the daily requirement of iodine by our body is around 150 micrograms. During pregnancy, the requirement of iodine is slightly increased up to 200 micrograms per day. Of course, this iodine, we receive it through our diet, through our food, and then the thyroid gland picks it up from the blood and utilizes for the synthesis of T3 and T4. But when there is a dietary deficiency of iodine, there is less amount of iodine in our blood. And because of this deficiency of iodine in the blood, the thyroid gland has to take more efforts to pick up the iodine from our blood. And in this process, in this extra efforts to trap, to catch the iodine from the blood, the thyroid gland is enlarged. Now, whenever there is deficiency of iodine, or indirectly, whenever there is deficiency of T3 and T4 because of lack of iodine, it can lead to mental dysfunction, especially in children, or if there is deficiency of iodine during pregnancy, the babies born, they would have some mental dysfunction. Or iodine deficiency can even be one of the reasons for abortions or stillbirths, giving birth to a dead baby. That's called as stillbirths. And one of the reasons is iodine deficiency during pregnancy. The child born to a iodine deficient mother can be idiotic. There can be troubles with low learning abilities. There can be defective growth. There can be lack of motor coordination, lack of nerve impulses. So iodine definitely is very, very important for every individual, but it's more important during pregnancy because it can also affect the health of the growing baby. Another condition which is related with the thyroid gland is goiter. It's the generalized enlargement of the thyroid gland with inflammation of the thyroid gland. Now, this inflammation, it can further lead to fibrosis, deposition of fibrous tissue in the gland. And then, because of this deposition of the fibers in the thyroid gland becomes firm, it becomes hard and nodular. So basically, goiter is an enlargement of the thyroid gland, but more or less the thyroid function would be normal. So it's a structural enlargement, but more or less the functions would be normal, and it would not affect any other systems, any other organs of our body. Now, there are different types of goiter, like simple non-toxic goiter or non-toxic multinodular goiter, depending on the nodules, depending on the hardness, depending on the nodes which are there in the thyroid gland, the goiter can be classified. So this is a classical picture of the enlargement of the thyroid gland or the goiter. And usually this is one of the symptoms which is more or less diagnostic of goiter. It's called as exophthalmus, or as if the eyes they are coming out. The eyes they look large and big, and as if they are popping out of the eye sockets. This is called as exophthalmus. Now, the two most important conditions, disorders related with the thyroid gland are hyperthyroidism and hypothyroidism. So, first, we will try to understand the symptoms of hyperthyroidism. This condition is also called as Graves' disease. Now, hyperthyroidism, as the name suggests, it is hyperactivity of the thyroid gland. In this condition, the levels of the thyroid hormone they are increased. They are on the higher side, and the thyroid gland is functioning more than the normal, secreting more hormones. So basically, because of high levels of thyroid hormones, the BMR, the basal metabolic rate, it increases in the people who are suffering from hyperthyroidism. Now, classically, these people, the appetite is increased, the hunger is increased. But even though they are eating more, it is associated with weight loss. So, this is one of the most important hallmark symptoms of hyperthyroidism. Even though they are eating more, they are hungry more, but still there is weight loss. This is because of increased BMR. Now, usually there is an anxious look on the face, and irritability or anger is quite common because of too much stimulation, too much high levels of the thyroid hormones. So they are irritable, they get angry quickly. Similarly, these people they are having increased sweating, there is heat intolerance. They cannot tolerate high temperatures, they cannot tolerate warm climatic conditions. Also, the heart rate is increased, the pulse rate, which can lead to a symptom of palpitation. The person would feel the heartbeats because of high, fast heart rate. Also, there is difficulty in breathing, dyspnea. So sometimes The person feels if they're having problem with their heart, then many a times it is related with the thyroid gland functioning. So it's important to note these symptoms at an early stage so that a diagnosis is established and a proper treatment is initiated. The higher levels of the hormone will also have a effect on the nervous system, on the nerves and the brain. So it will lead to restlessness or tremors in the hands can be one of the leading symptoms of hyperthyroidism. One of the initial symptoms of hyperthyroidism can be slight tremors in the fingers. Also, there can be insomnia, lack of sleep, less sleep, or disturbed sleep. Even though the person is eating well, the BMR is high, there would be muscular weakness. And as it has an effect on the nerves, there is a difficulty in changing the movements or changing the position. Initial movements, and change of positions can be a troublesome job. The eyes are also affected with one of the symptoms of protrusion as if they're popping out of the sockets. Sometimes they are also having a stare, a emotionless eye, emotionless stare in the eyes. There is a gritty sensation as if there is sand or dirt or dust in the eyes with diminished vision or diplopia. Diplopia is a condition where the person would see two things, like double. So one object appears double to this person. This is called as diplopia. The skin is typically warm and thick, or the explanation of the sensation of the skin is given as if the orange skin. It it feels to our hand like the fruit, the orange fruit skin, the covering of the orange fruit. It will also have an effect on the menstrual cycles. So, in many cases, hyperthyroidism can be presented as menstrual abnormalities. So because of these menstrual abnormalities, the T3, T4 levels are checked, and then accidentally hyperthyroidism is diagnosed. So two common menstrual irregularities will be polymenorrhea or a short menstrual cycle. Very short menstrual cycle, maybe 14 days, 15 days, or maybe 18 days. So very short menstrual cycle is polymenorrhea. And another condition can be amenorrhea. The menstruation would stop. No menstruation, no menstrual blood flow. So these conditions can also be associated with thyroid hormone levels. Of course, there can be other hormonal imbalances, but one of the reasons can be thyroid imbalance. And then another symptom, as I mentioned earlier, was the heat intolerance. These people cannot tolerate heat. These people cannot tolerate warm climatic conditions. So these are, in short, the symptoms of hyperthyroidism. Now moving on to the symptoms of hypothyroidism. In young children, this condition is called as cretinism, or in adults, it is called as myxedema. So, hypothyroidism. Now, in general, the symptoms of hypothyroidism would be exactly opposite, more or less exactly opposite to hyperthyroidism. Because hypothyroidism is less amounts of thyroid hormones, lower levels of thyroid hormones. So here, the most important symptom obviously would be reduced basal metabolic rate, reduced energy production, reduced energy utilization. So hypothyroidism is mostly associated with weight gain. The face also appears puffy because there is edema, there is swelling. As far as the mind, the brain, or the nervous system is concerned, there is slowness because there is less stimulation. So there is slowness of mental activities. This person may develop depression, and the milestones, the development would be delayed. The growth would be delayed. The growth of the skeleton, the growth of the muscles, it would be delayed. In these people, there is less amount of sweating. So the skin usually is cold to touch. Slight hypertension can develop in hypothyroidism, and it can be associated with breathlessness. Typically, this hypertension is a diastolic hypertension. Now, there is generalized slowness, mental slowness, similarly, physical slowness, lethargy, weakness, no enthusiasm, doesn't want to do anything. The skin is also very dry and scaly. This dryness is also in the hair, in the nails, leading to brittleness of the nail and loss of hair. Usually because of slowness of the muscular action, slowness of the muscular movement. These people, they suffer from constipation. Also, there is retention of water, accumulation of water, leading to edema, leading to swelling, overall swelling. In later stages, the voice becomes hoarse, hoarseness of voice, and even there is slowness in speech. So slowness is overall, it's mental, it's physical, even in the speech there would be slowness. Cold intolerance, I already mentioned. And of course, again, one of the symptoms of hypothyroidism can be irregularity in the menstrual cycles. Especially in hypothyroidism, the irregularity would be some cycles are short, some cycles are longer, or the menstrual cycles can be anovulatory, or there would be no ovulation, there would be no formation of the female egg, and so hypothyroidism can be one of the reasons of infertility. So in cases of infertility also, the levels of thyroid hormones need to be checked. So this was in short about the thyroid disorders. Especially we focused on the symptoms because many a times the symptoms can be indication of some abnormality of the thyroid gland function. And if the symptoms are closely watched, we can diagnose any disorder of the thyroid gland at an earlier stage. Because when there is some abnormal symptom, immediately the levels of the thyroid gland hormones T3 and T4 need to be checked, and we can reach an early diagnosis and initiate the treatment. We'll stop here. Hari Om.